lives. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com. By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Breathe clean filtered air with an Airtamer Personal Air Purifier. It's easy to have filtered air with an Airtamer Personal Air Purifier. An Airtamer Personal Air Purifier emits healthy negative ions to push airborne pollutants away from your breathing space. It's purified air wherever you go. The Airtamer Personal Air Purifier reduces viruses by 99% within 20 minutes. Go to drtomroselle.com/products to get an Airtamer Personal Air Purifier. For a limited time, use the coupon code Roselle and get a 20% discount and free shipping. Order today.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Are you suffering from flu-like symptoms? Get relief from muscle and body aches, headache, chills and fever, cough and congestion with Oleander 4X. Oleander 4X, made from oleander extract, is a tincture that provides relief for flu-like symptoms. Get relief with Oleander 4X. Go to drtomroselle.com/products to get Oleander 4X today. For a limited time, use the coupon code AgelessHealth and get a 10% discount. Order today.
information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, Dr. Tom here, and I have a great program for you, another Ageless Health Stream, and we're going to be talking about something really important, a little bit of controversy behind it, but I want to dig into it because we've heard about it, but we really don't put our finger on the why behind it, and it's called the HPA-Axis, or hypothalamus-pituitary-adrenal system. They're all interconnected, and it's what gives you your get up and go, or sometimes it got up and went and it's not there. So I want you to really understand that crazy fatigue that you can't get rid of, that problem that you have with focusing, the ability to have sensory perception relative to hot and cold, and some numbness and neuropathies and so forth, might be the result of that HPA-Axis not working the way it's supposed to. And that's because of a buildup of all types of stress patterns over a period of a long time, maybe, or many years. So let's look at the triad of health, right? Structural, chemical, emotional. The structural component has to do with anything that you can put your hands on that may have received an injury, whether the injury is significant or minor. And it could be simply a car accident, a fall, you bumped your head a dozen times, or it may have simply been the fact that you went to the dentist and the dentist got the vertical dimension of your temporomandibular joint in a wrong position. So now it disrupts the electrical flow and the communication of your spinal fluid and of the signaling throughout your body to, tell things to work properly. Biochemistry, all the things that you eat you shouldn't, all the things that you need more of you don't get enough of, today's world, the electrical fields, all of that stuff. And the third is the way your mind works. We make decisions on a day-to-day basis, and sometimes those decisions support us and we move forward, and sometimes those decisions put us on our knees and make us less able to recover, restore, and function. So what do I mean by that? So for example, somebody was told that they're going to die in the back of their head. Their brain goes, who told you that you have the right to tell me I'm going to die? I don't think so. Something clicks in, and suddenly they begin the process of recovery and restoration. Conversely, if somebody is told that there's, that because they're sick and they feel really lousy that they can recover, the brain says, I don't think so. I feel like I'm dying. The body will cooperate and begin to move forward in that direction and take us out. So what we want to do is we want to kind of walk through the puzzle just a little bit. The hypothalamus is located in the brain, and the pituitary gland is located in the brain, and your adrenals are these little ductless glands that sit on top of your kidneys, and they communicate. There's commonality between them, and there's nutraceuticals, amino acids, and so forth that work in tandem relative to how they communicate with each other, but also how they communicate with other systems. We see patients who are stressed out, if you want to use that term, and then what we see is their brain doesn't work the way it's supposed to. They begin to break down. They can't think. They forget names. And it's not the fact that they're suffering from an old age dementia or Alzheimer's or something of that nature, but it's the fact that what's taking place is that the stress patterns are evoking high levels of cortisol, and the inflammatory reaction is stopping the synapses of moving forward. But there's much more than that. And what I'm talking about is that it's the burn up, if you will, of different amino acids, different proteins, and so forth. We want to talk about one very specifically that I've mentioned on my radio program, but I want you to get it. There's an amino acid called tyrosine. Tyrosine is necessary in multi-systems in the body. And we're talking about tyrosine in the thyroid gland. If there's not enough tyrosine, you can't make the primary hormone called thyroxine. And obviously a combination, some iodine and some trace minerals, and providing there's not an inflammatory reaction, the pituitary signals the thyroid gland to produce this thyroxine, and then it goes down through other circuits to be able to go into the active hormone. T4 is what we're talking about, thyroxine, but it goes into T3, and that's what gets into your cells, providing it can transport. Okay, that's one piece of the puzzle. The fight-flight system, the adrenal glands, this internal portion of it is called the medulla, the adrenal medulla, produces what we used to call adrenaline, and now we subdivide those into epinephrine and norepinephrine, and they do different things. They target in different ways. They modulate each other, but if the internal portion, the tyrosine causes it to work the way it's supposed to and produce these hormones at a high enough level. If tyrosine is depleted or minimized or not working, then that system goes into adrenal fatigue, and in the medical terminology, Addison's, things of that nature. So how do we begin to pick this apart? What does that mean to you? Well, let me kind of frame it just a little bit to begin with. If you're under stress and your body's in a fight-flight reaction all the time, you're going to be in a adrenal, both outer shell adrenal cortex and inner shell adrenal medulla system of survival. It needs the tyrosine. So any available tyrosine, it's going to grab out of the bloodstream to utilize at the expense of other systems, particularly the thyroid. So you start seeing people over a period of time that their thyroid begins to dampen down, meaning it's not going to work at the level it's supposed to. They're starting to show symptoms. The upper eyebrows are thinning out. Their elbows are crusty. Their heels are crusty. Their voice becomes very slow and modulated. Their energy level kind of left them a long time ago. And they start finger pointing. So the doc does the laboratory work. And unfortunately, in our world today, the lab differentials are what the drug companies have come up with over a period of time. The problem is there's a sweet spot, and that's called functional medicine. One of these days, we're going to do this on the program. We're going to have some graphs and some charts. I'm going to show you what it should look like. But for right now, what I want you to understand is that the thyroid will suffer in response to keeping you alive, and that's the job of the adrenal system, because it helps regulate heart function, it helps blood sugar transport. The next phase is you start seeing your blood sugars get out of control. The adrenal system triggers the pancreas to produce insulin. Okay, it's called gluconeogenesis, or blood sugar transport's creation. And if you don't have enough tyrosine, that system suffers as well, at the expense of keeping your adrenal system in a normalized pattern. You ever get the experience where you bend over and you get up too rapidly, and all of a sudden the whole world gets really dizzy, or you turn your head from side to side too fast, and you have the same experience, and you say to yourself, and I haven't even had a drink? Well, that's part of what we're talking about. That's an orthostatic hypotension pattern that is controlled by your adrenal system. And we could do a functional process. That means that we're showing the symptoms, but there's no pathology yet. So when you evaluate that fight-flight system, you have to look at, one, the symptoms, but then you can look at and check and monitor the different hormones. And what we're talking about right now is the hormones that are created by the step called tyrosine pathway. And so we're looking at that HPA-Axis, the hypothalamus, the pituitary, the adrenal system. We're looking at the formation of cortisol within the system. Cortisol is not a good thing, right? That's where you get that fat belly, and it's real soft and jiggly, and it doesn't seem to go away. The rest of you is a little thin because that's what it's packing on you, is cortisol fat. But the modulation of cortisol up or down in a sweet spot that you need to keep you alive, because the truth of it is you need cortisol. It's not totally a bad guy. You need so much of it to keep things in a balance. And if that balance isn't there, you're in trouble. So when I look at a patient and they come in and they're complaining of a lot of different problems, back pain and joint irritation, and I can't think straight, all of those things begin to finger point in several directions. But one of the pieces that we have to deal with is that relationship to adrenal fight and the breakdown of that whole HPA-Axis. So we're going to look at different components. We're going to look at injury patterns. We're going to look at dietary stresses. We're going to look at, does the patient sleep? Do you sleep at the same time, uninterrupted all the night? Like, you don't need a lot of sleep, but you need 6.5 hours, maybe 7. And it has to be at the same time all the time without your iPads and your cell phones and your ambient light and all of those things. That has to be gone. You got to get rid of it out of your room. And by the way, you got to drop the temperature down to about 65 degrees. And you say, oh, 65 degrees, that's too cold. Well, get warm by curling up to your partner, or get warm by putting blankets on and so forth, but leave the ambient temperature of the room at a cooler level. That's critical. That's important. And by the way, get to bed before midnight. Go 11 o'clock, go to bed. And then get up, get up by 5:30, 6 o'clock in the morning. One of you are saying, oh my God, can't do that. I got to stay in bed. Well, it's because you're constantly listening to the talking heads. You're all jacked up. Your adrenal system's going through the ceiling. You're putting out that cortisol stress reaction, and then you can't move. So here's how you can judge a lot of the things that are happening. Do you wake up in the middle of the night for no reason? You just boom, your eyes wide open. What happens is cortisol pops up. When cortisol pops up as a result of your blood sugar crashing, it's not because you need a candy bar, it's because you haven't been eating enough protein in your system. So if that's the case, start backing down. What did you have to eat? When you've been to bed? What was your stress level? What was the last crazy person that you listened to on the TV screen? So we want to put these patterns together. We want to talk about this corticotrophin releasing factor, which is another piece in the HPA-Axis. And it puts out all kinds of other hormones, your adrenal corticosteroids, your glucocorticosteroids, glucose meaning blood sugar regulation, your androgens, which your testosterone, your estrogens, your progesterones. Guys, let me tell you something. One of the reasons that we're seeing so much over-the-top erectile dysfunction in young men is because this HPA-Axis, one, is not working the way it's supposed to work. And our brains don't shut down. They don't go into relaxed state. There's other reasons, like all the environmental estrogenics. We're getting hormones in our body that we shouldn't have at higher levels, and we don't have enough progesterone to blunt it. Here's our adrenal system again. The outer shell of the adrenal system produces progesterone that blunts excessive estrogens within the body and also allows tissue to stay calm and uninflamed. It's one of its jobs. So if we're in fight flight, we're in stress pattern, guess what happens? That system can't be balanced, and then we end up with too much estrogenic effects. It suppresses our other androgen formations and so forth, and we got a problem. We have a problem. We fail. We can't satisfy anybody. So understand that. I'm getting pretty straight up with this, but that's the deal. That's the way it is. We have to look at all the pathways that are associated with this crazy stuff. But stress, number one, will deplete the formation of the one amino acid we're talking about is tyrosine. And if we don't make enough tyrosine, we got a problem. And by the way, where does tyrosine come from? It comes from a substance called phenylalanine. And if that's not normal, we can back that system up all the way up. How do you know? How do you know your system is depleted? Just you telling. So you're going to find that you're going to have difficulty walking if tyrosine level's low. You're not going to have the normal gait and this normal savoir-faire, if you will. And it's an indicator there's a problem there. There's been a lot of studies that have been done utilizing tyrosine with athletes, and particularly under stress patterns and special forces operations, Navy SEALs. And when they're under that type of stress on an ongoing basis, they find that their mind becomes not able to focus adequately. So, with these guys, they're going to do all kinds of things with them to make sure that they stay on point and they stay purposely focused. But how about the rest of us? What do we know that can be done? Well, L-tyrosine has been known to upregulate adrenal function and also upregulate neurological function from the brain and allow the thyroid to begin to resolve its problems. The dosage is critical. It's one of those things where you can end up with what's called a floodgate effect. And here's what that means. Years ago, I learned that if you have a receptor and you're going to put a hormone into it or an amino acid into it, less is always better than more until you can find the adequate response. But sometimes we get into a mind frame that because we've been told X, Y, and Z works for us, we're going to what? We're going to overwhelm the system and we're going to flood the receptor. So now it acts as if it doesn't get anything. Well, we've used tyrosine up to about 20 grams, 20,000 milligrams a day, and it doesn't seem to have a bad effect in the initial phases. Long-term studies at that level have not been done. In the short term, if somebody tests for any substance, but particularly an amino acid, it's something that you want to make sure you cascade slowly, a little bit of time, little bit of time, little bit of time, until you get to the place where your results have been optimized. Now, that's if you're doing it that way. Now, in applied kinesiology or the world of diagnostic muscle testing, we can test it that way. We can also test it with blood. We can also test it with other samplings. But when you get that sweet spot, and you'll start noticing after about 2, 3, 4 weeks that things are a little different. They're not as dire as they used to be, that your energy level is suddenly perking up a little bit. And you can also find that when that happens, when you go to sleep, you're done, you're out. Remember how I said where you should sleep, right? But understand that this HPA-Axis is the first thing that gets stressed rapidly. I have a very dear friend, a colleague in Kansas City. His name is Dr. Evan Mladenoff, and he'll be a guest on this program. We're going to be talking on several things. One is we're going to talk about adrenal function because that was the sweet spot years ago. But we're also going to talk about concussive therapies and what happens long-term and how to pull yourself out of it, what that really means in the body. Again, he was a doctor of the Kansas City Chiefs for about 13 years. And so he understands stress patterns and concussive patterns. But from him, you're going to learn that unless you get your stress levels under control, no matter how much of anything that you put in the system, you're going to constantly revisit the same problem over and over. And even though that we're talking about tyrosine being very supportive, and if we want to modulate the adrenal system, we'll do things at a low level like what? Ashwagandha. It's an adaptogenic. It modulates the adrenal system. So it's not in constant fight flight, but it's in a place of a balance like this. It just kind of keeps it in a regular pathway, puts your body into a parasympathetic. That's where you heal. And there's other homeopathics and things like that that we do in our office as we evaluate the process. We have to make sure that what you're getting is in balance with other things, because too often, remember that floodgate effect? When you overwhelm the system, you're causing a depletion, an imbalance, a weakness in the other amino acids, whether essential amino acids means things that you have to supply, or things that non-essential, things that your body produces. And by the way, where does tyrosine come from in our natural? Because I said it's a non-essential amino acid. That means that it has to be supplied from other resources. Well, if you're a good meat eater, clean meats, you're going to get a lot of tyrosine from those substances, but they got to be clean. In today's world, sometimes that's a challenge, right? So we have to make sure that, the foods that we're putting in our system are not adulterated and not suppressed, don't have all kinds of garbage in it. That's your job to do your homework. Remember, those of you who've listened to me on the radio for years always hear me say, I don't want you to believe anyone, not including me. My job is to provoke you. My job is to make you listen and learn and then tell me that I'm wrong and go do your homework. And that's why we do this. That's why we constantly position the information in a way that we want you to say, oh, really? That's garbage. Well, maybe and maybe not. I want you to make that decision, but go in and start doing the studies and start reading. And if we can help you at all times, just get a hold of me, to drtomroselle.com and send me a note. Tell me what it is that I need to cover more specifically. Over a period of time, we're going to have some great interviews on this program. We're going to tell you about products. If you go to Dr. Tom Roselle and you go to the Ageless Health Store, you're going to find some amazing things that we vetted specifically for you. And we're going to make sure that we vet them, and we vet them extremely, extremely carefully so they serve you and they don't break your system down or cause that floodgate, a pattern someplace else. Look, it starts with what you put in your system. It starts with exercise. It starts with your sleep patterns. It starts with you being responsible for the things that need to be done. We're going to talk more about this ongoing process. Now, tyrosine has a very important input in dementia. And there's been studies out there now that they're using at extremely high levels. And they're seeing reversals of that memory loss. And particularly if they catch it early. I was doing some study in Neurosciences Journal this last week, and I came across a couple of articles that I got me to stop and say, really, I knew it helped, but I didn't realize it. So if that's the case, then we have a linkage between tyrosine depletion, if you will, and the onset of confusion and mental distortion. And I'm using those words specifically. That means mental distortion, mental clarity, the inability to perceive adequately. All those things are about that whole stress patterns, but also that there's not enough tyrosine because it's being eaten up by keeping your body alive. That's your adrenal system. Remember, that's the adrenal medulla. That affects your staying alive platform. So if that begins to deplete itself, and there's other pieces of the puzzle we're going to get into at some point, but right now we're focusing on this one piece and why we begin to see depletions. The other piece of the puzzle is that our foods are not what they used to be. And everybody thinks that, they can avoid meats and they can avoid animal products. And we go to carbohydrates, and the carbohydrates are refined and they're GMO modified. Some of us really take time to make sure that what goes into our bodies are very supportive of repair, growth, and restoration. And that's what you have to remember. Repair, growth, restoration is the key. Make sure that when you grab a hold of something, say, is this going to help me or is this going to hurt me? But if you start seeing that your body system is not working the way it's supposed to, meaning that you get dizzy when you move around, that you go outside and your eyes are hurting when you look at the sunlight, when you start forgetting certain situations, you feel so overwhelmed that you're biting at people. That can be a long-term breakdown of that HPA-Axis. And remember what I told you about thyroid function. The thyroid is an energy platform. And if it's not working, ladies, you're going to get difficult getting pregnant. You're going to have problems with nursing. You're going to have problems with getting the fat off your body after pregnancy. You might go into gestational diabetes if you get pregnant during that period of time. Guys, libido goes gone. Impotency takes place. Fat comes around your butt and your belly. Those are all kinds of adrenal axis, and there are many, many other players. But this HPA-Axis, this regulator on so many dimensions, is so critical. We could spend like 5 hours just talking this. I'm going to have experts on here with me that are going to give us more clues to this. But I want you to understand that this is resolvable. It's something that you can turn around until the day you breathe your last. My job with Ageless Health is to make sure you understand that you have control. Your health is in your hands, and you can make this happen at any stage going through the rest of your life. Thanks for joining me today. I'll be back next week with another very important piece of information to help you help yourself. I love you all. See you then.